sorry.
Hello? Hello, everyone? Hello? Order?
Hello? Hello? Hello, the judge is here. The judge is here. All rise. Sorry.
Thank you. You may be seated. Good morning.
How is it? Good to see you. How are you keeping? Long time.
We are about to start, and I'll ask the media to clear the gangway, please, so that we can settle down and start our proceedings. Molweni. Dumelang. We're going to start with arbitration proceedings, which is a formal tribunal. So I really ask again, as I've done many, many times, just Vumelena Nditi, we'll have no heckling, we'll have no singing or response to any of the evidence that will be given. And this is so because witnesses are entitled to protection so they can express themselves in the way that the law permits them. We are agreed, it's not a rally, it's a hearing, and I again ask you very respectfully that we must listen and express our unhappiness or happiness internally. That will be very helpful. Good morning, Ms. Mahlangu. You are welcome.
Good morning, Justice Masaneke.
Thank you. You're welcome in these proceedings. Please feel free. In which language do you want to testify?
Mainly in English, but probably during the cross-examination, I'll use vernacular language Zulu.
Oh, Zulu, okay, ma'am. As and when you get to a point where you'd like to switch over to isiZulu, just indicate to me, and there will be an interpreter available. So it's always open to you. With a prayer. Is any counsel, any objections to that? No. Ms. Mahlangu, do you have any objection to a prayer? Yes, it will be a short prayer, Father. And I know that there are bishops from the South African Council of Churches here present. So I think the clergy must decide who is going to render the prayer. So before you shoot ahead, look to your other side and you'll see that there are many bishops from the South African Council of Churches.
Should I ask Bishop to come up? Thank you very much.
Shall we wait for a brief prayer and we'll get on with the proceedings? Good morning, Bishop Siwa.
Good morning, Justice Musireke and the audience. Good morning, everyone. May I ask that we observe a brief moment of silence to accommodate all faith traditions. Let us be silent and pray in our own traditions. And so, Lord God, you have heard our prayers. We are meeting here on this holy ground, a place of tears, place of pain, but also place of hope for restoration and dignity. You are God of life. Even when lives have been lost, we invite your presence as God of life. You are God of justice. And so we plead with you that justice may flow like an unending stream. You are God of dignity. So we ask that, Lord, you restore our dignity, especially the dignity of the most vulnerable of society. We pray for these proceedings. Help us with your presence. Guide us with your presence. Heal us with your presence. Be with each and everyone who is going to participate, especially Justice Museneke and all those who are going to testify. Bring healing to your people. Bring healing and dignity and restoration to this nation. For this we ask in your name. Amen.
Amen. Thank you, Presiding Bishop. We are ready to proceed, and we should. Do you swear that the evidence you are about to give will be the truth and nothing but the truth? And if so, I ask you to raise your right hand and say, "So help me God."
So help me God.
Thank you. I have been informed in chambers that there are legal representatives present here at your behest. Could they indicate themselves?
Good morning, Justice.
Good morning, Counsel.
My name is Lesego Musi. I'm an advocate from the Duma Nokwe group of advocates in Sandton. I'm here instructed by Mr. Lebogang Rapiri from Rapiri Attorneys. We are ready to proceed. Just by way of background, we were instructed on Friday night to represent the former MEC, to assist her with a preparation for these proceedings.
Which Friday night?
This past Friday night. We did all we could. We burned the midnight oil to get ourselves ready. We prepared a witness statement. We traversed a plethora of documentary evidence availed to us. We also need to bring to your attention, Justice, that there were certain documentation that the former MEC requested from the department. She informed the evidence leaders. At the time when we concluded the preparation this morning, some of that information had not come to her attention or our attention. However, we are ready to proceed, and we prepared a witness statement. On top of that, there are annexures that we prepared. Now, for the purposes of smooth process, what we did, we got in touch with the evidence leaders over the past weekend. We met with Mr. Nkuchane, took him through the preparation. We are quite comfortable that the witness can start to lead the testimony during the process of the proceedings, because some material is being copied in the building. We will make same available to the legal team. We have prepared an unsigned statement for the purposes of the evidence leading team so that they can get on through the process. We have prepared also similar for justice so that he can follow. For our comfort, we plead that as soon as a signed statement with the necessary annexures are ready during the course of the day, that we hand same. For now, we are ready to proceed. Thank you.
Thank you, Counsel. You said your last name is Musi.
Musi,
Advocate-
double M-U-S-I.
Advocate Musi. We have followed that. We will wait until the documentation is ready and the statement is signed, and it could be handed in as and when it is available and ready. Certainly not later than the course of today, for obvious reasons, to allow your colleagues to prepare cross-examination.
We shall indeed do so.
Thank you. Thanks. Advocate Nguchana.
Thank you, Justice Msaneke. From the explanation from my colleague is that not all of the attached annexures to the statement are available, but we will receive them during the course of the day as we go along. But in the meantime, she will start going through her statement. That would form part of the evidence. And I see here there are a number of other copies which I will request my learned colleague to have them disseminated to our colleagues so that they may follow when she testifies or speak to
They
the
are
statement.
copies of the
The
statement
statement, this-
unsigned. Is
Unsigned,
that it?
that's
Very well.
correct. Yeah.
And does Ms. Mahlangu have a copy in front of her?
Yes, yes, Justice, I do have a copy.
You do.
May I request my Mr. Musi to address that issue?
Justice, we have the unsigned statement which was printed for the purposes of proceedings. Now, for the purposes of the legal team to follow, I undertake to hand same during the course of the proceedings today. I just need to go through the final document and make sure that the document that we hand is that accords with the normal standards and practices.
Advocate Musi, you have the copies now. Are you ready to distribute them?
I have unsigned copy. I still need to go through it. The witness can go through her testimony. For the purposes of distribution and preparation and cross-examination, I would feel comfortable if I go through the statement, satisfy myself that the copy we distribute to enable them to do effective cross-examination accords with the best available practices and standards.
All this means you'll give us an edited copy later. That is fine. We're going to proceed with the witness.
Yes.
A statement is not a prerequisite to evidence.
Yes.
When you're ready, give your colleagues copies and give me a copy, signed or unsigned. Very well?
Yes. Yes. But
Okay.
yes, we can hand the unsigned one to the judge so that the judge can follow.
Very well. What you give me, you must give to your colleagues. You know how it works.
Yes.
So I can't have something which the advocates don't have.
I prefer
Take your time.
I
When
prefer
you're
to hand
ready-
it later.
Yes, when you're ready, give it later, okay?
Yes.
Very well. Thank you. Advocate Guchana,
Thank you, Justice
let's get
Msaneke.
on with it.
Yes, we will request the witness, Ms. Mahlangu, to start with the statement first, and thereafter we shall lead her on the specifics, either of the statement and the evidence in general. My colleague, Ms. Yina, would at a later stage deal with the other specific facts which came out during the proceedings.
Yes.
But
Ve-
But from now, I would take over and request the statement, that is, and request the witness to deal with the issues. Ms. Mahlangu, you have now been sworn in. I understand that you have prepared a statement. Before you deal with the statement, I'll request you to deal with, there is one issue that came up during December. I'm sure you recall that attempts were made to have you in attendance here during the course of December or November, and you were unavailable. Could you please deal with that issue? Why were you not available to assist us during November or December?
Thank you very much.
Could it be that you were refusing to come here deliberately, or you were completely unavailable to assist us?
Thank you, Council. My name is Qedani Mahlangu. To answer your question specifically, after I resigned from government on the 1st of February 2017, at the time I did not know what I wanted to do, and I applied my mind after several weeks and months. And around May, I applied in different universities, particularly outside of South Africa, and I got accepted, and I paid for my studies, and then I left beginning of August, and I did inform the African National Congress leadership, as you've seen in previous statements, that I was going to study for a period of a year, the Masters in Business Administration, largely specializing in global banking, and doing things like mergers and acquisition and all of that. So the commitment I'd made at the time to go and study, I did not know anything that was going to happen post my departure from government. Nobody from government indicated that there was going to be this process. If indeed there was going to be this process, how it was going to happen, was I going to be needed, if so, when? So I left under the impression that nothing was going to happen because nobody said anything to me. It was only in October I started hearing people sending messages that something is going on. People are mentioning my name. At the time, I did indicate that I am available, and there was no need for me to be forced, because I didn't run away. I live in South Africa. I have a home. I have a family. And everything is in South Africa. I have no intention of living anywhere else. So I never ran away of this. And of course, my commitments in the UK, particularly with my studies, was about with the Bedfordshire universities I was registered with. And in the process of when I started with my MBA, particularly the module on mergers and acquisition, I took an interest in accounting. So I enrolled in a program for accounting, and I've been doing the two programs parallel. The other programs I was attending in the evenings, and the other program I was attending full time. So my being in the UK had to do with my studies in the process. So I've never run away from this. And even with my previous lawyers I was working with, it was my intention to come in November. It was my intention to come in December. But through our engagement, they advised me that it is best to come in January, and I obliged. And they met with the team at the time, and they kept on informing me back and forth about this thing. So that is the intention. I've never had any intention of running away, because it's not in my nature to do so. Thank you.
Thank you. And now let's get back to the issues now. And when were you appointed to government as an MEC for the Department of Health?
Maybe just to say that I've been an MEC from 2004.
From 2004?
And I've held respective portfolios. In health, I was an MEC for health in 2009 till 2010 November, end of November. And I was redeployed to economic development, from economic development to infrastructure, from infrastructure back to health in 2014. So I've been in the provincial government, serving in the executive for 12 years, 8 months by the time when I resigned.
Okay. And what is your educational qualification?
I have I finished matric in 1988.
Yes.
And I started teaching, but it was just a by the way kind of thing. So, and when I finished that was 1995. I started 1993 till 1995, and I lost all my papers with the Department of Education. I don't know how and why, but yeah, as a result, I hardly mentioned the teaching qualification in my CV. And then I took interest in finance and economics. I enrolled with the University of South Africa, UNISA, to start my studies towards economics and finance. 1 year at UNISA when I was in Parliament in Cape Town from 1998 till 2004. From UNISA then, there was a collaboration between UNISA and UWC. And that program, we qualified, we finished, I think, 3 years later with an advanced diploma in economics. And I then later continued with UWC, the University of the Western Cape. And I have an honors in economics. And I think about 2012, if I'm not mistaken, I enrolled with the University of London to study Masters in Finance, which I finished in 2015, December. In 2016, July, I went to the UK to go and attend my graduation. So I currently, those are my qualifications, and in between, I attended the short courses in Washington, at the University, Washington University in the US. I went to Williams College again on the short courses, and before I left the Department of Health, I had encouraged about 25 senior managers, including the current acting HOD, Dr. Kenoshi, to enroll on a program with the University of Lancaster in the UK. Why Lancaster is because Lancaster University trains NHS, the National Health Service hospital managers in the UK. And also I thought that it was important for South African health hospital managers to understand and to be trained in Lancaster. So I took part.
Sorry to interrupt you. In 2016, when you went to graduate in London, for which degree was that?
It was the Masters in Finance.
Masters in Finance.
Yes.
Thank you. And your current registration is
for a Masters in Business Administration, mainly in global banking.
Yes.
And with the London School of Business and Finance, I'm registered to, as I'm saying, it's an accounting course. It's a professional course. As I'm speaking now, I am registered, of course, as a student with the ACCA. ACCA is a accounting, or is an association of certified chartered accountants in the UK. So because I'm intending to pursue, I took it as a by the way because I got interested when I was doing my measures and acquisition course. So then I decided to, and I'm going to pursue my studies in finishing that program, and I hope to be able to finish in 3 years and get a BSc in accounting.
So you might have, so how many degrees do you have and diplomas? Have you ever sat down to count?
No, I think I have 3 at most.
3 diplomas?
No, one advanced diploma, and which is equivalent to a degree, and an honors degree and a master's degree. And as I'm saying, when I finish my MBA, of course, it will be my 4th degree. My intention is to study for my PhD.
But with your current London studies, you would then have 2 master's degrees, 1 honors.
Yes, yeah.
And
yes,
then
yes,
you'd
yes.
have an advanced diploma
Yes.
as well as a diploma.
Yes, absolutely. That's correct.
And let's just wrap it all at this stage. So you served as MEC for 12 years?
For 12 years, 8 months to be exact.
12 years, 8 months. Thank you. Counsel?
Yeah, thank you. And let's now get to your statement. How would you prefer to do it? I think my suggestion to you is that read it into the record. If reference is made to annexures, let's deal with the specific portions in the annexures you want to rely on, not the entire annexure. You don't have to explain the entire annexure, I think, from page 1 to the last page. Can we start from the first page?
Thank you, Council. Please bear with me when I have difficulties to, from time to time. But
you have a considerable audience, so it will help. You can hear how loudly I speak, so it will help. You can't keep it at that level all the time, but let it be clear enough for people in here to hear you. Thank you.
I'll do my best, Justice, to meet that requirement. Generally, my voice is very soft, and I know fans speak very fast, but I'll do my best to slow down the tempo.
Yes.
I, Qedani Mahlangu, hereby state that the loss of life our country experienced following the termination of life Esidimeni service level agreement is certainly one of the most painful ever incidents in the history of the South African health system. The deaths of approximately 140 mental health care users is indeed painful and regrettable. And I want to upfront express my sincere condolences to the families who lost their loved ones following the termination of the Life Esidimeni service level agreement, including the removal of the mental health patients from Life Esidimeni healthcare facilities. Our healthcare system is meant to preserve and where humanly possible, to prolong human life. In this regard, our primary role as a Department of Health then, in the transfer of patients from Life Esidimeni, was to ensure that we deliver service to all the people of Gauteng. Clearly, this did not go according to plan. And for that, I sincerely apologize. Did not go according to plan, and it is indeed very unfortunate and deeply regrettable that the implementation of this project ended up with a tragic loss of life. And I am really sorry that innocent and vulnerable members of our society lost their loved one in that process. I hope my testimony at these hearings will help families to find closure and also explore consequences where it is necessary. It is important to state that the Life Esidimeni project had good intentions. And I don't think anybody planned that people are going to die or people are going to be killed. And in my experience as an activist, at one point, I was trained how to hold or detonate a hand grenade, how to dismantle an AK-47 and all of that. And at no point
Sorry, just 1 minute. Andy, we can't wait and call a witness who we want to listen to and then go shouting. We can't do that. So I ask you to keep quiet and you'll have your moment through your advocates to speak, please. We've agreed what you don't like and what you like, you have to take in and find other moments. But in the hearing, again, lastly, the witness is entitled to some level of dignity. And so allow her to say what she says, and we can find other ways of expressing that. Please. Ms. Mahlangu.
Thank you, Justice. Firstly, the deinstitutionalization of mental health users. In other words, the reason for the project was to integrate mental health patients into communities instead of keeping them permanently institutionalized in hospitals. For far too long, mental health users have been treated as social outcasts, and this took place against the accepted international practice, which seeks to ensure that mental health users are integrated within and or among society. Secondly, the project was responding to various queries, previous negative audit findings of the Auditor General in respective engagement with the officials relating to the service level agreement with Life Esidimeni. In simple terms, Life Esidimeni enjoyed benefits out of contract which existed since 1979 without it being subjected to the tender processes in line with the Public Finance Management Act and all its prescriptions and regulations, as well as the Constitution, Section 217 of the Constitution of the Republic of South Africa. Section 217 of the Constitution requires all organs of state to procure goods and services through a system which is fair, equitable, competitive, transparent, and cost-effective. In other words, the fact that the contract enjoyed benefits of a contract which did not comply with the previous provision of the Constitution. I have taken liberty to appear in these proceedings to share with this Commission information relating to the life Esidimeni, which information is within my personal knowledge because I've not been in the system since the 1st of February last year. And to the extent that I was able to remember things and to find information, and this is what I'm presenting before the Commission and before you, Justice Moseneke.
Yes. Let me just say that this is an arbitration, it's not a commission.
Sorry, my apology.
It doesn't matter. It's just important to clarify that. Thank you.
To the members of the families gathered here, the families who lost their loved ones during the implementation of this project, I am deeply sorry for your loss. And may their souls rest in peace. I know that we may not bring them back, but for what it's worth, I am really, really sorry. Justice Moseneke, I wish to give an account of my involvement as the then MEC for Health in relation to the implementation of the Life Esidimeni project. As a background, in 2014, shortly after the general elections, I was duly appointed as a member of the Executive Council responsible for health, herein to thereafter referred to in the Gauteng province. By virtue of my appointment, I became the executive authority of the department, and my duties were largely as described by legislation and the Constitution and the Public Finance Management Act and other supporting legislation. And I also had the responsibility to oversee the implementation of government policy in line with the mandate of the Department of Health. During and around that time, the department had financial constraints and was under administration in terms of Section 18 of the Public Finance Management Act, Act number 1 of 1999, PFMA, of which when I was in Parliament, this is one of the legislation we worked very hard for it to be produced to be what it is today. The cost of healthcare continued to escalate, leading to more budgetary constraints across the budget of the Department of Health. At the Premier's Budget Committee, from now on to refer to as a PBC, meeting held in November 2014, after the departmental presentations, which I annexed here, which is the Annexure A, the Life Esidimeni did not form part of our presentation to the Budget Committee. During this meeting, the department was requested to develop a plan to reduce costs and to ensure that the departmental over-expenditure was reduced. Similar instruction, of course, were given to all other departments as well because of the budgetary constraint generally that the government was experiencing. In response to the budget, the PBC, a directive referred to in the above paragraph, the head of department, then Dr. Esidimeni, assisted by other officials, engaged in a process to develop a plan, indeed, to cut costs. I later received the cost presentation from the HOD, Dr. Esidimeni, which I said is Annexure A. Dr. Esidimeni also shared the contents of the annexure with the provincial treasury through the normal processes that the official engaged. Inter alia, the presentation included the following, but not limited to the termination or the revision of the following services. It was the Alexandra Healthcare Clinic, which was run by an NGO at the cost higher than what other clinics equivalent to the same size were being run. The second one was the Selby Park Clinic, which was a step-down facility for people who were not too well to go home, but were not too sick to stay in hospitals. The third one was Life Esidimeni. Fourth was Telkom, Vodacom, security services, long-term incapacity leave for 12 months onwards, National Health Laboratory Services, cost, the laundry services, road accident fund, as well as stationery. One of the first cost-cutting exercises to be implemented or terminated was the Selby Park Clinic. The department, through its official, implemented this proposal and finalized it in May because the contract was ending in May. As I said, the Selby Park Clinic attracted, again, like Life Esidimeni, had attracted negative comments from the Auditor General in that the contract had been renewed without the department following supply chain year after year, and the AG became uncomfortable. And normally, if you continue with the contract persistently without following tender processes, renewing the contract, it raises query with the Auditor General, and in subsequent years, it may be expressed as an fruitful or wasteful expenditure, something like that, in that. I may not be expressing exactly the term in what this will result in the end. The HOD, assisted by other officials, developed the Life Esidimeni plan. I'm sure you've seen that implementation plan. In addition to the implementation plan referred to above, the officials in the department led by the HOD developed and presented the plan to me, a template against which the NGOs which were to take over from Life Esidimeni will be assessed, and a copy of the template is annexed to as Mark B. And I am aware it is existing in some of the files that Advocate Ngutjane had shared with us.
Did you have to approve the plan?
No, I did not have to approve the plan, Justice.
So the HOD was the final arbiter on the plan, was it?
Yes, the responsibility of any politician is defined by legislation, and things that are of implementation nature, those are implemented, are at the discretion and in the purview of the head of the department, who reports to the executing authority, whether it's a minister or the premier or the relevant politician in that portfolio where the person is reporting to.
Yeah, questions will come later. It just struck me that it's something that was not clear in the statement about Dr. Silibano, the HOD, could have continued without your consent. In other words, as a matter of law,
absolutely,
he did not need your consent.
No, not at all.
Very well, proceed.
Things that would require the executing authorities' approval, those will be signed in the form of a memo signed, and therefore after that, once they get that approval, then it will say, okay, the MEC has approved or the minister has approved. On the basis of that, the go-ahead is given. The department also established the Life Esidimeni Implementation Committee, and again, led by the HOD, and he assigned respective officials. I was advised by Dr. Silibano, which I also accepted and relied on, that prior to the termination of the Life Esidimeni contract, he sought and obtained legal opinion which advised the department to terminate the Life Esidimeni service level agreement. I do not have a copy of the legal opinion with me, but I have a reason to believe that the department has a copy of that opinion.
Who sourced the legal opinion?
The head of department.
The head of department,
yes.
Thank you.
In line with the Public Finance Management Act and other legislation, I provided guidance when I was required to do so in informal meetings held with the officials in line with the role of the executive authority when necessary. In order to ensure that implementation of the project committee was required to meet on a weekly basis, and I attended several meetings whenever I was available, where I provided guidance when called upon to do so.
Former MEC, there's a hand from one of the advocates. Would you pause, please?
My apologies, Justice, but because we don't have the prepared written statement in front of us, it's difficult to follow. So my request is to ask the witness to just go a little slower so that we can absorb what she's telling us.
Okay. The request is that you don't read it like a news reader. You know how quickly they read things?
I apologize, Justice.
You do it more like an actor. Have you seen actors? They speak slowly, and they drop every word clearly. So They're asking you to take it a little slower. The statement will be made available to council, but it's a fair request that you go a little slower. Thank you.
Thank you very much, Justice.
Okay, ma'am.
During the initial phase of the project, I was given assurance that the project committee, through the HOD, that the implementation of the project was on track, despite a few teething problems. Issues of concern, such as shortage of food, blankets, were not presented to informal meetings, with the exception of the supply of medicines. And at the time, it was mentioned that when the mental health care users were living life, Esidimeni, they were given a supply of medicines only for 7 days. And that's the only problem that I got to understand that was raised with me at the time. When all the operational plans, which included the template, had been presented to me, including the briefing by the HOD on the legal opinion, I did not have any reason to doubt information received consistently from officials in formal meetings, as I said, simply because you work with people on the basis of the level of trust. And when you begin to doubt the credibility of the information that you have, they bring at your disposal, that will not permit any good and cordial working environment. I never received information that the project was at risk or that implementation of the project will then threaten lives of patients. And in general, I received constant positive reports regarding the implementation of the project. I had full confidence in the managers as well as professional expertise of the HOD and his team.
Can you mention the managers by name that you had confidence in?
It's the HOD and Dr. Libete, who's the DDG for clinical services. Msenochi, who was, I think he's Chief Director for Planning, if I'm not mistaken. Dr. Manamela, who's the Director for Mental Health. And of course, in the process, we brought in people from their respective hospitals that are currently dealing with psychiatric patients. That will be CEO of Vescopis, Mrs. Mabena. It will be the CEO of Sterkfontein. Forgot his surname. Yeah, I forgot his surname. And it will be the CEO of Kalinen Hospital, as well as the chief directors of the 5 districts in the province, because the NGOs will be located in the communities where the districts are operating, and they are also coordinating the clinic. So we thought that it was relevant for those team members to be brought on board. So that's the team, and of course there were junior officials that reports to them. I may not remember all the name or have all the names, but I saw the list in Advocate Ngujane's document that he sent me, that he gave to me. Some of the names are listed.
The list of the project team.
The project team will be yes. There. And
so
from time to time, the CFO, we invited the CFO to meetings, particularly when I was present, because I wanted to make sure that issues relating to finance are dealt with properly. And we also brought in the HR for the purposes of making sure that the staffing issues are also addressed accordingly.
So in short, you had seen that there was a project team with competent senior and junior officials, and you were happy and certain that the Life Esidimeni project was being competently handled.
Yes, absolutely, Justice.
Very well. You may proceed with the statement.
During about November 2015, I received an invitation from the Office of the Premier to attend a meeting, and the purpose of the meeting was to discuss the letter sent to the Premier by NEHAU, wherein NEHAU requested the Department of Health to absorb employees who was working at at the Selby Park Clinic, as well as Life Esidimeni staff as part of the exit strategy out of the 2 contracts that the department was terminating. The staff to be absorbed included nurses, cleaners, and all people who met the government employment requirement in line with the public service regulation requirement.
And this was in August 2015?
No, this was in November 2015.
Or November 2015, I'm sorry, November 20.
Then
the Premier, that's when the Premier called you in?
To a meeting, yes.
Very well.
And there is a correspondence to that effect, and I forgot to send it to my counsel, but I will email it to him tonight, and you'll get it tomorrow. I requested the HOD together with one other official, I can't remember who, to accompany me to the meeting with the Premier, because during the said meeting, it was agreed that the Selby Park Clinic and Life Esidimeni staff will be absorbed in the department in line with applicable policies and where the public service regulations applied. We also agreed that and some of them would be placed in the various NGOs, will be appointed to take over from the Life Esidimeni.
Before we proceed, do we have a list of these employees, the number of them?
I don't have it on top of my head. I was trying to get it, but I don't have it. But I think it was close to about 700 people, workers or so. But I'm sure that if you ask the HR department of the Department of Health, they should be able to tell you who was absorbed, and if that information is requested. As I said, my counsel did indicate early on that I couldn't have all the information that I needed as soon as I wanted it. Thank you.
Then, from your recollection, were these employees all absorbed or not?
As far as I remember, and this is just from the top of my head, most of them were absorbed, and if I'm not mistaken, I remember getting 2 or 3 phone calls from nurses who were absorbed from Life Esidimeni back into the department, who previously were employed by the Department of Health, and they were not paid simply because that when they left the department, they were blacklisted on PESAL, and their salaries could not be paid. And once you're blacklisted on PESAL, and the system kicks you out. So I then engaged with the relevant HR people and the HOD to look into the matter. And I seem to remember that there was a technicality in one of the categories, I can't remember which one, which the post which those people where they were in either at Life or Selby did not meet any of the criteria in government. And I can't remember how that issue was resolved. As I said, I don't have the documents and the relevant information before me. But majority of them were absorbed.
Thank you. You can proceed.
Subsequent to the meeting with NEHAU, I was informed that Section 27 organization took the department to court, challenging the implementation of the termination of the Life Esidimeni contract.
When would this be? I see that there's no date there.
I think it was around November 2015. It was much bulk of the things, like, of course, things that were like probably preceding the formal starting of the project was around November, and that's why the meeting with the Premier and NEHAU was around November. So all these more activities were around more or less the same time. And I think the statement is written more or less in the chronological order based on the events that took place as I remember them at the time.
So the meeting of November 2015, where the Premier was present, were the representatives of NEHAU also present?
It was the Secretary General of NEHAU. I forgot his name. And the NEHAU leadership in Gauteng, and I think one COSATU provincial leadership in the province.
And the HOD was also present?
Yes, the HOD was present. I did not go to meetings without the HOD in most of the instances, unless it was something that happened outside of work, whatever. But in many of the things, meetings I had gone to, it was with the HOD, because at the end of the day, whatever transpires out of meeting, he is responsible for implementation, particularly where things are supposed to be executed.
And at that meeting, the closure of Selby and Esidimeni were discussed?
The invitation clearly stated that the purpose of the meeting was to discuss the closure of Life Esidimeni and Selby, as well as also to look at the issues relating to the workers.
And your position and that of the Premier, that of the HOD and the leaders of Nehau ended up in an agreement?
Yes, we agreed that the HOD will work with the relevant HR team in the department to ensure that those workers are absorbed. Because no one should lose their jobs because of this. That was agreed in the meeting.
You may proceed.
I want to state that the court application was never brought to my attention. To be precise, I was informed of the application only after the matter has been finalized in court. I did not oppose the court application, though I was cited in my official capacity in the said papers. I understand that the said application was dismissed by the court.
Is that what you were informed, that it was dismissed?
Yes.
Okay. And who informed you, if you can recollect?
I think it was the HOD or Dr. Lebet. I'm not sure exactly the exact individuals.
Oh, thank you.
In January 2016, the department was ready to meet with the families of the patients to be affected by the move from Life Esidimeni. In this regard, we agreed with the HOD that I will visit the Waverley to meet with the families. And if I'm not mistaken, the HOD was also present in that meeting when we went to the Waverley. And the next day, I was not going to be able to make it. There was something that I had to attend to. And the HOD went to Waverley, to Randfontein the next day to meet with the families in Randfontein. During my meeting...
The Waverley meeting was the one where the families of the patients were present?
Yes, yes, Justice.
And it was quite a active meeting where the families expressed their views to you.
Yes.
Is that the meeting?
Yes, the families raised concerns, and out of those concerns, I suggested to the families that they should establish a family committee meeting. And in that meeting, I also gave them my mobile number, which has been my standard practice since I took off in public office in 2004, that any citizen has a right to contact me directly to raise any concern they have. So out of that meeting, a family committee meeting was formed, and as I said, I gave them my number to be able to call me in case that there were concerns, and particularly because I said to them, I know sometimes officials may not do what it's supposed to be done, and where you have concerns relating to the places where your family members are going to be moved, please talk to me and with the concern you're having at the time. And I don't remember receiving a single call out of that. Once again, I wish to state for the record that I was never informed of many major problems other than the teething problems relating to patient files that the Life Healthcare Group was refusing to release the patient's record, and as a result, that became really a back and forth issue between the department and the officials.
Who would ordinarily have informed you? Obviously, the HOD was in charge of the move, isn't it, from Esidimeni?
Yes, remember the HOD is the overall accounting officer, so he assigns certain people who report to him. So when we have broader meeting, which involves me in my boardroom or in the 22nd floor boardroom, then the HOD will be present when he was available. When he was not, he'll put an apology, and they'll make the presentation. So it was mentioned in one of those meetings that indeed this was the case.
So when you say you're not informed of the problems of the move, does it mean the HOD did not keep you abreast with the developments?
I'm not sure, Judge, whether he did not know himself or that junior officials didn't tell him. I wouldn't be able to speak for him. But for my part, that I did not know that there were problems. Let me leave it there.
Thank you. Proceed.
And once again, I wish to state that on record, of course, I've already made this point. During one of the meetings, it was reported that some patients, this was reported by in the formal meeting again, that some patient had arrived at Vescopis who were being relocated from the Life Esidimeni and Sterkfontein with single clothing items, some with one pair or one shoe instead of having a pair of shoes, and others walked in there and they looked like very malnourished in the process. And I think two of them, I remember specifically from Vescopis, they were on arrival, they looked malnourished, and immediately they were referred to Kalafong Hospital at the time, as it was explained in the meeting on that day.
Let me understand that paragraph. That is paragraph 41.
Yes.
So this will be clients, that is patients who were transferred directly from Life Esidimeni.
Yes, to Vescopis.
So upon their arrival there, they noticed that they are malnourished?
Yes.
Oh, I see.
And then the Sterkfontein team would have reported that the mental health care users were arriving from Life. They looked ungroomed, unshaven, and they were looking like that they were not looked after at the time on arrival. And then I think Sterkfontein, particularly, I know because when I visited there, I found that they designed a tracksuit, or they bought tracksuit with the Sterkfontein logo as part of just giving dignity and ensuring that at least they have something decent to wear. And in one of the interviews I had with Radio 702, wherein I made a plea for members of the public to assist with the donation on items such as clothing, pajamas, tracksuit, and shoes for the benefit of the patients. And I'm sure that if you were to ask, look or trace to the 702 records, you'll be able to trace this information. I also wrote a letter to...
Could you put a date to that?
Which
a month and a year when you asked for donations
I think it was
from the public for patients?
It was either September or October. I'm really not.
2016.
2016, all of 2016, yes. And I also wrote a letter to the CEO of Telecom, asking them to consider using their CSI resources to help us to improve some of the things that I was concerned about once we were aware of the challenges. I also wrote a letter to IDC, CEO, also requesting them to do the same, to help us to do the same.
Can you remember why it was necessary to beg for donations within the Department of Health? The patients were now out of Life Esidimeni, and they had to be looked after and fed on donations. Can you remember why you made the plea?
But just as I was just saying a few minutes ago, that it was brought to my attention that the mental health care users did not come out of Life with the decent clothes. They came either with one set of clothes they were wearing when they walked out of there, and therefore the NGOs were trying to help to mobilize clothing, as well as the department. I know that they bought, I found in one, when I went to Caledon on the 1st of July, I found them, they brought blankets and then all of that. So it was really about getting the society to be mobilized to say, this is what I've been told, and I'm requesting everyone who can contribute to come to the party to contribute so that we can give them dignity in the process.
And what happened to state funds? Had they run out for these patients?
Justice, the Department of Health, okay, when I was working there and I'm going to talk about the period I know, there are competing needs within the budget of the department. And those needs sometimes necessitate that you rob Peter to pay Paul at any given point in time. What do I mean by that? If there's an expenditure in one program, which may be considered that the money, we can afford to move this money from this program to the next program because there's a pressing need, you'll end up doing that. So simply because, of course, the disease burden, all of us probably are aware that is on the rise and across the board, not only mental health, that the HIV challenges that we face as a country, despite the fact that we're the smallest country in the world, probably amongst many nations, but our numbers in terms of people who are HIV positive is high. So all those challenges that they eat from the budget of the department, so you get to put as many people as possible into the ARV program. You've got to make sure that children are get vaccination. You've got to make sure that laundries are functioning. You've got to make sure that every one of those things are working. But not over and above that, that whatever rand you have, you've got to spread to the extent possible that you are able not to compromise the quality of care. But in the process, challenges do occur.
I understand that. But once the marathon project was underway and patients were taken out of life, Esidimeni, was there no budget for that transition, for that move? That's what I mean. Why did you have to go begging for donations for these patients? Wasn't there an anticipated expenditure connected to the transfer?
The expenditure was made. The CFO did avail resources for things to be bought. Exactly what they bought in all of that, I would not be having those kind of specific together with the HOD. But at any given point in time, I can point to you exactly what did the private sector donate at Charlotte Maxeke, as far as I remember. What did the private sector donate at Qedani Mahlangu, as far as I remember, and all of those things. And that doesn't mean that government does not have money, but government needs to work with the private sector in order to complement the little resources we have because of the growing needs of people who want to have access to the healthcare system. And the costs are rising, the budgets are increasing, and on the basis of that, you really have to find challenges. At any given point in time, at the time, you'll come to Charlotte when you do your oversights, and you find women who are about to give birth, and probably 50% of them won't be South Africans. They were not budgeted for. But they must be helped to give birth because they're already in the country. So all of those things contribute to the fact that the budget gets reduced. Over and above that, when doctors and nurses do their work in the normal course of their business, something will go wrong in theater, wherever in the hospital business. And when that happens, we end up with medical legal. They sue the department. When they sue the department, and that is not budgeted for, that comes as a court order, and you have to settle that court order. And that's really the difficulty that we've got to juggle every single day to try and understand what do you do with the lack of budget, yet the needs are growing on daily basis. That's the challenges we're facing. So mobilizing society did not mean by any chance, Justice, that the department was absorbing its responsibility to cater for the mental health care users. It was simply really to complement what government was able to do at the time. And I still believe in, if I'm not in the system, those donations and those things are still required today. It may not be for mental health care users, it may be for other things. And if I remember very well, in 2009, we requested Discovery to donate stethoscopes. And they donated them in numbers.
But just assure me, coming back to the marathon project, assure me that there was money budgeted to anticipate costs connected with moving mental health care users from Life Esidimeni to the NGOs. Was that provided for?
I think it was provided for. I didn't see the actual numbers and things, but it was provided for, because when there were challenges of food and whatever, the CFO intervened on several occasions when those things were brought to our attention.
Okay. You may proceed. Thank you.
After the project team had completed the scoping of the project and entering into the implementation phase of the project, the process of moving patients to various facilities was commenced with. I must add that when the Life Esidimeni released the patients to various NGOs, they did so without releasing the patient file. I had to intervene, and I do not have the letter. I did request to try and get it, which I wrote personally to the CEO of Life, and requested him that we should have the patient's record. And as well as in that letter, I was asking him to that they should look at the list of occupational therapists they had, so that we can tap into those, that they can be deployed in the several things. So that letter, I don't have it. As I said, it is with government records. So probably if the CEO would be kind enough to share the contents of that letter that I wrote to him. And in that letter also, I stated to him, because there was no formal communication with Life about Banning, that we are not going to cancel the Banning contract. We will extend it for a period of 2 years, but the tariffs, modalities on the tariffs, those will be negotiated by the relevant officials led by the HOD.
Could your staff members starting from the HOD safely transfer patients to other facilities without medical records?
As far as I know, that was not supposed to happen, but it did happen.
Yeah, but could one safely take mental health care users from where they were? Let's assume Life Esidimeni refused with the records. Can one safely take them somewhere else? And they continue to be well or in good health, or at least as good as they were at Life Esidimeni?
I wouldn't be able to answer with authority on that question, Judge Justice, because I am not a medical doctor, but it's the little information I have suggests that, of course, I can use my practical example. When my mother gets transferred from a hospital in Mpumalanga to come to Joburg to Charlotte for specialized treatment, her file will be with her. And at any given point in time, and I can relate a couple of friends who would have asked me to assist them about this and that, and the respective teams other from Limpopo will simply say, will not release the patient if there is no confirmation of a receiving doctor and the relevant information required. So that question really I can't answer with authority because I'm not competent to deal with it.
Yeah, but at a common sense level, I'm not a doctor either. Wouldn't you require the bed letter of a patient in order to continue with therapy at another site?
I was informed, Justice, that basic information was given. I don't know how basic it was, but I was informed that it was given. And as I went around, I think I went to about 2 or 3 NGOs because there were just too many to visit, so we spread ourselves. But in the NGOs I went, I asked to see the files, particularly at Masiho, and I asked to see the files of the patients who've been there for longer compared to those who just arrived. Even them, they simply told me that they did not have files of the patients, the thicker files of the patients when they left. And just to further elaborate this point, after I wrote the letter to Life, we engaged with the CEO of Life, some files, particularly of the number of people at the time I was aware that would have died, they sent us those files in an electronic form. And one patient file will be probably about 5 or 6 boxes. They were as thick as that. So, and none of the NGOs had that kind of information. And my conversation with the CEO of Life at the time, and again, in one meeting I was with the HOD, in another meeting I was with Dr. Libet. Actually, we met here at the Moyen. The issue was about we should have the access to the files so that whoever is managing the files, wherever they are, post the move. Because that was, I think the meeting was in September. They should be able to have that information, but it was never forthcoming. Even the information that we took to the ombudsperson, we got it under a lot of difficulties and challenges.
You may proceed.
Before you proceed, I just want to find out when was it when you were informed that patients were released without files?
It was meant.
And when did you intervene by writing this letter?
I wrote the letter in September because I realized that things were not like being acted upon. But in meetings it was raised, and I continuously appealed to the team as professionals. I worked with professionals, very qualified people, as far as I'm concerned, and I had no doubt that the team of people I worked with are well qualified, well suitable, and they've been in the system longer. So they know their responsibilities and duties, and I was comfortable that they know what they are doing, and because they are professional over and above everything.
That's September 2016.
Yes, I wrote the letter, I think September, October 2016. As I'm saying, I wish that I could have had it in front of me, but...
On second thought now, let me see, knowing what you know now, how many people had died in September 2016? Can you remember?
From the information I was given by the HOD through when the question was raised in the legislature, the answer I gave to the legislature was that there were 36 people who had died.
And that was in when? Was in August?
It was exactly on the 13th of September, if I'm not mistaken. It was a Tuesday, yeah.
So as you were pleading for records and so on, on your knowledge, what number of people had died? 30?
With the 36.
36.
Yes.
Okay, you may proceed.
When was this thing raised with you?
Pardon?
When was this thing raised with you of the missing records, patients' files?
I think it was raised in 1 or 2 meetings. I can't remember exactly the date.
You would know the month or so?
No, I wouldn't. No, I wouldn't, unless I see a document or whatever, probably, yeah.
But it wouldn't be far from the date when you intervened? Say, for example, it's raised in September, and in September, during September, you write the letter.
Probably it could have been earlier than the time when I wrote the letter. It could have been earlier. I'm not sure exactly. It could have been somewhere in August or so. I don't know exactly, but it was not earlier than that.
Oh, it was not earlier. Oh,
yeah.
Thank you. You can proceed.
And remember, just Council, please remember that all of these things I'm saying based on my memory, and as to the extent that I still remember things as much as possible.
No, thank you. Thank you.
You are at the point where you requested records from the CO of Life Esidimeni.
I think now you're on paragraph 45.
Yeah, I'm just coming back to that. The first key challenge to be brought to my attention was the food shortage at an NGO in Cullinan. And I took upon myself to visit the Cullinan facility to find out what was going on. At the exact date, it was the 1st of July. It was very late at night. I went there and we met with I walked around and how we got to...
Let me see to add the year every time.
Oh, sorry.
The events run over several years, so in July 2016.
2016, yes, yes, yeah. So I went to Cullinan very late in the evening because I got concerned that this journalist kept on asking me questions about things, and whatever I answer, I realized that probably I may not have the full facts before me. So we drove to Cullinan that evening, and we walked around the facility, we looked at the things, and remember there's a Cullinan hospital which has been existing, I think, from 1973, if I'm not mistaken. And within that facility of the hospital, there were wards which were renovated where the NGOs were being accommodated. So we walked around the hospital in its entirety, from where the patients, the government patients were, and where the NGO was. What I picked up in that visit was the 2 NGOs. One of them was called Siabadinga, and I don't know what's the other one called.
Is it not Anchor House?
Was it Anchor? Something like that. I'm just not sure exactly about the name.
Life Disciples?
No, it's not Life Disciples. I think it was Anchor. Okay. I think so, if I'm not mistaken. So the 2 NGOs were operating there. and they were meant to share a kitchen. The stove was not big enough. And then I did ask the staff to intervene and to resource the relevant things that were of concern to me. And I was assured again that they will attend to those things. And I do know that Mrs. Mure and Mrs. Mary Grace Msimango worked with me, and they intervened on the nursing because on the HR issues relating to the nurses. So they intervened on that, and I do know that nurses were employed subsequent to their intervention, and they took nurses as well for training and all of that. So that I do know, because they waited for me there for a couple of hours as I was going there.
What other problems were you able to find out with this NGO?
I think it was the stove.
Other than the stove, were there any other?
It was the stove and the cold room, that the NGOs were sharing a cold room, and I think they were fighting, these two NGOs. And I said to them, this is not about you, it's about the patient you're serving. And because one of them was taking the department to court, whatever, and I asked the officials, can you please make sure that you separate, have 2 cold rooms for these people to exist in this one place, and all of that. So, and I left the messages there for the relevant.
Once you were there, is there the place that you were happy mental health care users ought to be kept and looked after?
The wards were just recently refurbished, Justice. There were new wards. The Department of Infrastructure had refurbished the wards. They looked new. What I was concerned at the time was, when we walked around, was overcrowding, which I did raise with the official. And I said, but why do so many people in here? They said, oh, these are functional patients, whatever. And then later on, when I went to another NGO, I think it was towards the end of September, if I'm not mistaken, that was Precious Angel. And I found some of the patients at Precious Angel, which were at Cullinan, and I asked, but why are these patients here? And I can't remember the answer I received.
Did you actually go to Precious Angel physically?
No, I went to Precious Angel probably late September.
Yes.
Yeah.
There will be many questions that will be asked. You see how many advocates are here. So we'll get to there. Is this your evidence in chief? Still going to be many, many questions. As you take a breath, do you now know how many people died? By people, I mean mental health care users at Siabadinga.
No, I am not aware specifically about Siabadinga.
Do you know how many mental health care users died at Anchor Life?
I wouldn't be aware, Justice, of the specifics per NGOs.
Do you know how many mental health care users died at Precious Angel?
At the time, it was said that it was late September. They said it was 18.
18.
Yes.
When you visited there?
No. I think it was after my visit.
After your visit. Yes. Okay, let's proceed.
Yeah. Before you proceed on that, other than the overcrowding, were you not informed of any other problems that these NGOs had, like payment of subsidies, sharing of hospital space, and so on?
As at the end of the 1st of July, when I went to Cullinan, then I was not aware of the payment problems. I think, again, they were brought to my attention through my media liaison officer to say there are issues of payment. And once I got to know about that, we then intervened. We asked the CFO to work with the relevant managers, because they must feed information to, I think it's covered, something I'll talk about in the statement. They must feed, everybody who does business with the Gauteng government must register in the database. And the registration is done by officials relevant from a particular district, and then they get registered at Treasury. And once they're registered, only then the process, they get purchase order numbers. From there, then they get paid. So I wouldn't really, that's what I know about the payment. But once it was brought to my attention, I asked the CFO and the HOD, please, can we intervene? And they intervened. In our subsequent Friday mornings meetings, when we're discussing finance, from there onwards, I started monitoring that, and it was clear that indeed the payment were being done consistently.
But did this brilliant work project team not say MEC, we've made no arrangements for funds to flow to the NGOs. Your patients, what you call rightly government patients, might die
No,
because NGOs are receiving no money from us. None of them alert you to that, MEC?
Justice, nobody alerted me that patients did not have food in formal meetings. As I said, the issue of food and all the challenges you're asking me about, we got to know about those through the media. And only then we intervened. And I got to know, I think, just in the past few days or so, that information was being brought to Dr. Manamela by the NGOs, but I wasn't aware. I think the difficulty that, as much as I considered myself very accessible to everybody who had issues, whether it's a cleaner or patient or a doctor or an intern, whatever, I encouraged for people to call me. And I do remember, I think, and I can't remember exactly the date, that I went to a meeting with the Tshwane NGOs and I said to them, what are your challenges? What are you going through and all of that? So they did share the problems of payment. They did share the problems that they sometimes go on weeks without being paid. And again, I gave them my cell number. If the things we discussed today are not being followed through and not being implemented, please call me. And of course, I can only plead and plead and plead. The minute I start saying, now I'm going to procure directly, the law is, I'm really violating the legislation because my duties are very direct, are very specific.
There'll be many detailed questions that will be coming very shortly, but let's leave you in your evidence in chief so that you complete it. And one of those inevitably is going to be, how do 143 people die? And you don't know of it. You don't know the circumstances under which they were living. And they are your patients, government patients. You can keep that in mind. It will be asked later more fully. Please go ahead with your evidence.
Okay. During the time, I was totally unaware of the patients that were dying at various NGOs in the different centers. During or about September 2016, I received a question through the legislature on the Life Esidimeni project. When the question are posed from the legislature, the procedure is that such questions are sent to the MEC's parliamentary officer, who in turn sends the list of such questions to the office of the HOD for assistance with answers to the question posed. He may in turn source the responses from the relevant officials in the department. And once the HOD receives the information required, he sends the same info to the MEC's office, and thereafter I go to the legislature and to respond to the question based on information that has been signed off and sent to my office from the office of the HOD, sourced from the different people.
So the HOD would provide the facts that would be contained in your answer.
Yes, absolutely.
To the legislature.
Absolutely. I first became aware that 36 patients had passed away at various NGOs and hospitals on the evening of the 12th of September, just as I was preparing to go to the legislature. And it was very, very late at night. And in the morning, I was going to the legislature. This is happening during my preparation question and answer to the legislature, which I answered on the 13th of September. This information, as I said, was received from the office of the HOD, as well as other officials who might have assisted the HOD to put the information together. On the following day, I proceeded to provide responses to the question to the legislature. Less than 24 hours after providing the answers to in the legislature, I contacted Professor Makgoba, the Ombudsman, requesting him to assist the department with investigation of the causes of death of the 36 patients. I annexed the transcript of my cell phone SMS communication with Professor Makgoba, marked E. On the same day, in the afternoon, I had a meeting with the minister to discuss the Nelson Mandela Children's Hospital budget. I approached the minister requesting him, because I had spoken to the professor in the morning and he was not keen at the time when I spoke to him. when I indicated that to the minister said he will help me to convince the prof to take this mandate of investigating this.
This is the Minister of Health?
Yes. Yes, when we had a meeting to discuss the Nelson Mandela Children's Hospital, and in that process, before the meeting started, he asked me what is happening, and I told him, and I said, I called the professor in the morning, and he said, my conversation with him is part of the Annexure E, you'll see. I called him, and he responded via SMS, all is contained in the Annexure E.
So you have a date when you approach the minister?
Yes, what's all happened on the 14th. I answered the question on the 13th. I then called the professor on the 14th in the morning.
Yes.
And then he responded. We had a brief conversation. Then at 10:26 to be exact, you'll see from the transcript of my cell phone, he responded with his response. And then I went to the minister to say to him, I approached Prof, this is what he said to me, and I'm thinking of appointing somebody else. The minister said, no, I will help you to convince the professor. And then the minister spoke to the professor, and we take it from there.
No, it's fine. We'll come to that when your annexures, all of your annexures are ready. You can proceed.
Thank you very much. I, together with the members of staff, held planning meetings with various, including the HOD, with various, with a view to constitute various teams for the purpose of visiting the NGOs. That was over a weekend. Can't remember the exact date, which was after I think there's a weekend of the 16th, 17th or so. I may not be accurate, but I think it was the 16th.
September 2016.
Yes, December 2016. To visit the NGO, because I began to be worried that there's something that probably I may be missing on the basis of the information that I was getting.
And what did Dr. Manamela say? I mean, 36 lives have been lost in the project.
The explanation...
We started in May, it's September, so in 4 months. On that count, we know the count was inaccurate, but on that count, 36 patients had lost their lives in the project. What did she say?
The answer, Justice, was that the patients who would have died in different hospitals, causes of natural death cause of death was natural, and so I had no reason to doubt the information that I was given. But what exactly happened? Where did these people die? What happened? And then I was given that explanation. But I then took comfort.
Did she say? I'm sorry to interrupt you. Did she say the causes of death of the 36 were natural causes?
Yes, because apparently the death certificate, that's what they said.
And she assured you that you don't have to worry because these are natural deaths.
But already I had approached remember, Justice, that I answered the question on Tuesday. Wednesday already, I spoke to the Professor Makhoba, and in the same afternoon, I spoke to the minister. So already I was a little bit comfortable in that we are going to do something about it to investigate the real cause of that. And I was very sure that I'm going to make sure that the department cooperates with the process so that the truth indeed can be established.
Didn't you believe her when she said the deaths were caused naturally? Why did you need the ombudsman?
But also I was concerned, Prof. Sorry, Justice, that 36 people died, and there seems not to be a clear explanation. Pacers Angel alone just had 18 people. So I just thought let's try and satisfy ourselves and the families that indeed something did not go wrong in the process. So that was really about making sure that we established the facts as to exactly what happened. And that's why I thought getting someone independent to do investigation will help to establish the facts.
And what did Dr. Silibano say? He was the one who was reporting to you directly. What did he say about these 36 deaths, at least for starters?
No, he supported that we should go ahead with the investigation. Yes. We agreed, both of us, that we should proceed with the investigation.
Very well, proceed.
Before you proceed, this someone independent which you requested to assist, you're referring to Professor Makgoba,
Yes.
and he did the investigations. That's common cause now.
Yes, absolutely.
And
Councillor.
he produced a report, which I assume that you have read it.
Yes, Councillor.
And do you know what he says about the cause of death?
He said different things, that some people died of hydration and others died of malnourishment. So, but okay, maybe whilst I'm on this point, I need to put it on record that the documents I was requesting through you, that I submitted to Professor Makgoba on behalf of the department, in there, it was cases we opened from the police in order for the postmortems to be done, because I indicated to the team that it's better that nothing is hidden from this process. If there are families who have done postmortems, it's okay. But if there are families who have not done it, please persuade them to get their family members that the postmortems can be done. And at the time, some of the family members were already buried. And I asked Dr. Libete to be exact, to work on that, because previously he was the CEO of the Gauteng Forensic Services, so to work with the laboratories to make sure that those postmortems are done. In my submission to the ombudsperson, you will find those detailed cases and the case numbers in which police station they were opened at, and by the respective CEOs where the bodies were still located at the time. And after the cases were opened, those bodies were taken directly to either to the Pretoria Forensic Laboratory, or some, I think, one or two from the West End, with either done at the Hillbrow or at the Deep Kloof Mortuary. So that's that. So I made sure that nothing is covered from that evidence, indeed. And that's what that I did after I heard about this.
Yeah, the point I wanted to converse with you on that before you proceed is that you accept, that is, you wanted somebody else independent, who is Professor Makgoba, to assist you, and the investigations were done and he produced the report. Do we accept his findings in relation to the cause of death?
Well, I'm not a forensic laboratory specialist. So, and also from the legal counsel team I was working with, they were engaging with the NPA and I think the SAPS to try and get the results of the postmortems. And as far as my memory says, if my memory serves me well, that information is not available as per the communication from the NPA or from SAPS. So I will not be in a position really to speak on authority on that matter at all.
Okay. No. My focus was just limited on that a report was produced. You requested the report. A report was produced. It's got findings. Do you accept the report, or you don't accept the report?
I'm no longer in government. Government has accepted the report, and the report has been implemented, and I think the best people to deal with it. If you had asked me the question on the 31st, before I resigned, I would have given you my answer, but my answer is neither here nor there.
No, it's fine. Thank you. You can proceed. You're on paragraph. Do you still recall the paragraph?
Yeah, I think...
You can help the witness so that we can
is
proceed.
it 55?
55.
55.
Am I right?
Yes, you are correct.
It will help me to know how many more paragraphs are there in relation to the tea break.
It runs to paragraph 69. Some are short, some are long. Some it's one sentences. We can take the tea adjournment.
It's 11:30. I think I'm going to take the tea adjournment now. Ms. Mahlangu, we're going to have an adjournment from
Yes,
now
Justice.
till 12 midday. And I require you to be back here at 12 and to take the witness stand.
Thank you very much, Justice.
Thank you.
Thank you.
We are adjourned.
Thank you, Council. In Pretoria, I visited an NGO called Precious Angel. I had a conversation with the owner of the NGO after doing walkabouts, who informed me that the NGO had received no payments for 2 months or so from the department. Upon probing, I discovered that the NGO was not registered was not on the database of the provincial treasury. And I immediately requested that the HOD and the CFO and the team from the Tshwane district to work with the NGO with the necessary registration processes and or documentation so that the payment, it could receive payment. All this happened in the month of September 2016.
And again on this, were you told why were these pre-arrangements, that is pre-transfer arrangements were not done?
I don't remember a clear explanation to that effect, but it concerned me that NGOs we have entrusted with mental health care users were not being fairly treated, in the sense that payment was not done on time. As a result, that was having negative impact on the patient. And that's why the HOD, being the highest official accounting officer in the department, I requested him and the CFO to intervene and ensure that this is corrected with immediate effect.
Yes, thank you. And would you, would you agree that this non-payment of the NGOs, specifically subsidies, would have a negative impact on the quality of services that they will ultimately receive?
Definitely. I mean, if I know one of the things that NGOs do not have the ability to have a strong balance sheet like you'll have in a big company or an established company like the Life Healthcare Group. So when there are challenges of not consistent payment, they have nowhere else to look for or have long lifeline from the banks to be able to get that money and continue the treatment. Indeed, it was a concern, and I think the point you're making about whether it could have affected the quality of care, I think it did.
Thank you. Can proceed on 56.
But what did the HOD say to you? You say there was no clear explanation.
I think at the time the explanation was that, Justice, I explained earlier on that in Gauteng, for any service provider to provide services in the department and they must register on the Gauteng database, Gauteng government database, and then be given a purchase order number. I don't even know how it looks like, but something that I know that it exists. Once they have a purchase order number, then they can proceed to file for invoices. And when invoices are filed, only then payment can be done.
But your team must have known this.
Absolutely.
Former MEC, they must have known when they were planning for nearly a year that on day one, NGOs will need resources, didn't they? They should have, surely.
Yes, Justice, they should have known. And that's why it really concerned me a great deal when I heard that this did not happen. And hence I requested the HOD as the most senior person in the department, together with the CFO, to do everything possible that this is corrected. And from there on, we then, in our Friday meetings, to discuss the state of finances in the department, because it remained a problem throughout. We then included the reporting on how NGOs across the board were being paid their allocation and whether they are being paid on time, and if not so, what will be the problems, and ensure that those are attended to immediately.
You know now, former MEC, that from May to September through to December, many people died. And that period coincides with the 4 months when there was no money flowing from your department to the NGOs.
Yes, now I understand to be the case, Justice.
And did Dr. Manamela or Dr. Silibano ever give you an account? Did they tell you why didn't they plan for the core part of the transfer of patients from one location to another? There must be resources at the new place. Did they ever explain why they didn't do that?
I mean, the explanation, Justice, that would be given, for instance, okay, let me just say this, that once I got to know about the problems and once we've approached the ombudsperson to help us to investigate, things became a bit difficult and tense in the department. And of course, levels of trust, I think, degenerated to the lowest level, in particular, the mental health program. And I mean, the department is a huge elephant. So the specific unit concerned in dealing with this matter, to an extent that I was made aware that there were challenges within the team, amongst the team members of the mental health unit. So in relation to your question you're asking specifically, what did they do or why they didn't inform me that there were challenges of payments and things, I wouldn't know exactly why that information was withheld from me, simply because indeed I know that the MECs are not supposed to be operational and we're not operational by law. There's a clear distinction of that. If I were to interfere and start doing things that politicians are not supposed to do, I can go to jail. So those distinctions are very important, that officials in government, their responsibilities defined by law and that of the politicians. So I take information that's given to me and explanations given to me. And beyond that, I can only appeal and appeal and appeal.
Well, I have to tell you, and you're going to get many questions on that, will be coming your way shortly. Both say you instructed them to proceed with the marathon project, for better, for worse. They both seated where you were seated, and you know this because you've been receiving our transcripts. And they say you are the one who instructed them. You say you knew nothing. They didn't tell you. The public is entitled to know where the truth sits, surely. Because you are a political functionary, and you owe that to the public of this country.
Justice, as I said, I think I can't remember exactly which paragraph in my statement, that once we've been to the, when I'm saying we, it is myself, the HOD, and relevant officials necessary to be present when the budget discussions are held with the provincial treasury in the Premier's Budget Committee. Once those processes, we came back from that, the team that draws up the nitty-gritties of the plan in response to what we've been asked to do from the Budget Committee, it's an operational matter. It is done through the HOD by the rest of the officials. Then these issues came, as I said, I listed those items from the Alex Clinic, Selby Park, Life Esidimeni, all of those. They came as part and parcel of the process, and the annexer is here. And if I may take you through that annexer, I'm more than willing to do so, to say what is it that we presented.
Then you'll be asked those questions. I was asking a much more narrower, overarching question. The question I was asking you was, Manabela and Silibano both say you instructed them to proceed with the marathon project. You this morning say you knew nothing about its implementation. So I invite you as a political principal, or as you were then, to explain that to us. Help us understand that. They say they were under your command. You say you knew nothing, and you didn't have to instruct them at all.
Justice, the fact that as a political head, the administrative team led by the HOD, the MEC or the minister or the politician concerned is a commander, that is absolutely factual and true. our responsibilities are defined by law. And when those responsibilities are defined by law, that means the Public Finance Management Act defines what I can do and what I can't do. And the Public Finance Management also recognizes that if an official, or let's say argue that if I'm being instructed as an MEC by someone above me to do certain things that I don't agree with, the law protects you. Be it a politician or be it an official, that if you're being instructed to do something that's illegal, that's something that is going to compromise services and whatever else, you are entitled to report that matter, or that's going to lead to over expenditure or whatever. You are entitled to report to the Auditor General and file the same information to the Treasury. At any given point in time, when the implementation progress reports were being given to me, I did say that progress reports were being given to me. So when progress reports were being given to me, at no stage that there was a presentation in a meeting that says, MEC, this is impossible, it can't happen, and now we, can you please review this thing? In actual fact, what would have happened, and the Premier will say probably this when he comes, that in the early stages, I think there's a question I answered in the legislature, November 18, if I'm not mistaken, November 18, 2015, which indicated that at the time that 1,700 or 2,000, something, a figure like that, beds were going to be made available to accommodate the mental health care users from life. And where were these beds going to be found? The report, even the answer I gave to the legislature, and subsequently the Premier was asked the same information, and I shared it with him because that's what I was being given.
In short, you're saying Dr. Manamela and Dr. Silibano told you that there will be 1,700 odd beds available for the transfer. Is that what you're saying?
And including, just to mention specifically, the names of the hospitals are listed there. Germiston, the old Germiston Hospital, the old Mamelodi Hospital, the old this and that, all of them were mentioned. And at the time, it was the indication was that only fewer patients were going to go to the NGOs.
Yeah, but you're saying at the time it was mentioned. Tell us who mentioned that. Who said to you?
In the progress meetings that I had with the team.
And that's the meeting where, and you brought in the Premier quite early. You say the Premier knew about this quite early. Did I understand you well?
Yes, you did.
And
2015.
Yes. Was it
not a process
up to
started
date?
in 2014, 2015, right?
So he knew that Life Esidimeni was going to be shut down?
Yes, he knew. And when we had a meeting with Nehau, we did not discuss anything else but where the workers were going to be placed. As I said, I forgot to send the documents to my counsel, and he will submit that tomorrow.
And the HOD, as well as Dr. Manamela, assured you and the Premier that there will be 1,700 beds available for these patients?
Yes, through the answers they gave to me, which I answered the question, and through the answers that were given, I sent to the Premier's office, which were also asked from the Premier to answer in the legislature through that process. Those questions can be asked from the MEC or the Premier, and it can be the same information. So whatever information was given to me on the question asked to the Premier, I submitted that. On the basis of that, he went to the legislature and answered.
All this council will put details to you, but let me say this to you. Now you know that they misled you, isn't it?
Yes, I am aware, Judge. Justice.
In other words, they lied to you and to the Premier about the project.
Yes, Justice.
And because of those lies, i.e. taking many, the bulk of the people to NGOs, many of those patients died.
Can you please repeat your question
or statement? I will. I want you to finish your evidence in chief. I was just struck by the fact that these two senior people, Silibano and Manamela, gave you and the Premier false information about the availability of places of care. In other words, which have beds.
Yes, absolutely.
And they said to you, by far, the majority of the people will be moved from Life Esidimeni would be kept in, will have beds and will have proper places. Now we know it didn't happen.
Absolutely.
And many people died at NGOs. I'm saying they, in effect, lied to you and the Premier in their reports.
I think they provided inaccurate reports, and on the basis I do believe that people are telling the truth because these are professionals. I'm not talking about people who do not know what's wrong and right. The people who are trained in whatever profession that they've qualified on. So
let me leave you there for now. They sat right there and said, you instructed them. But for your insistence, the project would not have gone on.
Justice, I'm not sure how, if you don't get it, you get information in respective meetings that you're holding with the team, which suggests that things are going okay. MEC we've placed at the time, I'm no longer MEC now, says in this hospital we're placing so many, the Department of Infrastructure has fixed this ward, this NGO is able to take this number of patients, this person is able to take this number or whatever. So when you're given that information, you take comfort that these officials have done the groundwork. And I had no reason to doubt the professional, their professional conduct, and that they were not behaving in a manner that in keeping with the mandate of what the department is supposed to do.
Just for clarity and for our record, those who reported to you in that way, that reassured you, were Dr. Silibano and Dr. Manamela.
Yes, Dr. Silibano Manamela, and through formal meetings, and we'll all have a formal meetings. Manamela will make a presentation, or Mr. Nochi will make a presentation, or the relevant official or relating to HR, whatever. And after those discussions, okay, progress report, great. Then, for instance, the media liaison officer will then say, let me see, let's give progress to the public on what we're doing. And he'll go ahead and issue a media statement on the basis of what we've been given in the formal meetings of the department. I'm sure those media statements are contained in the various files before the arbitration committee.
And you know now, as we all know, they misled you.
Yes, I do now. No,
and they misled the Premier.
Yes, I know, Justice.
Would you proceed?
Thank you, Justice Msanek. Ms. Mahlangu, you can proceed at 56.
Okay. I need to mention that around the same period of September 2016, I received several media queries regarding the exact number of deaths which had occurred on the Life Esidimeni project. I continued to receive more questions from the media, who informed me, amongst others, the number had increased to 68, and I had no full information regarding these questions. I requested Dr. Libete to facilitate the performance and finalization of the autopsies and to register the cases with the case numbers relating to the same. And I think we had a meeting with the MEC for safety with the relevant official, just to ensure that all the processes, what the department should have done, indeed it was done. And I proceed. Throughout the time, I was unaware of the causes of death, and I believe that the whole matter required full investigation. Hence, I did say that I approached the ombudsperson to help us to investigate this matter. And I proceeded to convene the departmental team for planning and visitation to the various NGO, which we spread ourselves in different teams, and we were joined by the ministerial team on that Saturday and Sunday.
But you know, former MEC, once you then heard that 68 people had died, couldn't you say, stop the madness, stop? We can't continue with the project. This is hardly halfway of the people who died, 68. Why didn't you tell Silibano and Manamela to stop? Because this thing was not working.
The placement was completed, Justice, at the time. So they were no longer mental health care users at any of the life facilities. They were either at the NGOs or at Weskopie Sterkfontein or Cullinan Hospital, or in the respective private district hospitals where there were spare bed capacity.
So you say the only route then open to the mental health care users was that they would suffer or die at the NGOs? You mean you could not reverse it?
No, that's not what I'm saying. I continued to, the visit to NGOs was about ensuring that we check everything, whether what we've been reported to in accordance with the tool that has been shared is in one of the files, that indeed those things have been done. Where they've not been done, ensure that the team, impress upon the team to do those, follow up on those things. And it's on those bases that the visits to NGOs, they were not done once. At least I went to a couple of them, but the officials, the understanding was that they'll continue to visit the NGOs and improve and continue to monitor areas of improvements which were identified in the respective NGOs which were visited over one weekend, all of them across the province.
If the majority of the 1,700 patients or so were actually placed in hospitals as the original plan was contemplated, would we have had deaths to this extent?
I wouldn't be able to answer, Judge Justice. I don't know. I wouldn't be able to answer that question.
Okay, proceed.
When we then undertook the visit to various NGOs to inspect the infrastructure to ascertain whether or not there were adequate sleeping arrangement, availability of medication, food, first aid kits, and to assess all matters which needed verification in terms of the template the department had developed earlier. The Mental Health Review Board was invited as well to join in the visit to the different NGOs. I visited an NGO in Sirman, that is in Hammanskraal. I was accompanied on that weekend by Professor Freeman from the National Department of Health, Jeanette Hunter, Dr. Manamela, and other officials, as well as members of the Health Review Board. Amongst the items we paid attention to, in line with the template designed after the earlier availability of the nursing staff, security, the toilet facilities, bathrooms, dining places, food, medication, and the general grounds in the NGOs, whether the mental health care users have sufficient space to move around within those NGOs. I then gave a directive to the HOD after we finished those visits and the team to continue to visit the NGOs, particularly where there were challenges to ensure that the patients were taken care of, as well as to ensuring that general compliance with legislation is adhered to. Thereafter, I compiled a report because Professor Makhoba gave us a deadline. I can't remember the exact dates of when we were supposed to submit documentation for him to start the investigation. During the compilation of the report, I discovered a number of documents which I was seeing for the first time. And one of them is the Health Africa Institute report, which actually I got to learn about that report much later when I was engaging with the ombuds on a continuous basis, on the ombudsperson on a continuous basis. He asked me for the high report, which is called it in brief, high, and then I said to him, I'm not sure what he was referring to, and then he sent me what he was looking for. I then inquired from the HOD, he did not know, and I asked Dr. Manamela, indeed he sent me the report, and I did send it to the ombudsperson, but I did not know until the investigation had started that kind of a report existed, and it was commissioned by the department.
And why would they keep away such a vital report from the political head?
I don't know, Justice. I really don't know.
Do you remember the key findings of that report?
Yes, I read the report, and amongst other things were the staffing issues at Life, and how many staff members who were looking after patients during the day as well as at night, was the issues of medication, it was the issues of, I don't know. But broad terms, like more or less issues about patient care as well as staffing in that kind of or set of issues. And after I read the report, once I sent it to the ombudsperson, I did request the HOD to consider, of course verbally, to request him to consider that the department should work with the Health Africa Institute to support the NGOs so that indeed they can improve the quality, the conditions.
No, but what was the core finding of that report in relation to costing and funding
the report
of
suggested
services at Esidimeni?
The report suggested that the service that Life was delivering were relatively suitable and were adequate to the in term from a costing point of view. But in the absence of comparing that to any other thing, and that's what I find in the report, as I said, with all the other issues, medication and some challenges that I would have picked up in the report.
Did you notice that per patient you were doing better than your other hospitals?
Our
cost per patient, yes?
Departmental hospitals?
Yes.
I didn't do that comparison in the greatest of details.
Proceed.
Such information included, but not limited to the following. The reports that Life was giving, that stats covering period before the termination of the contract to the department, ranging from 2010, 2011, 2012, and 2013. And these that statistics, we also submitted them to the ombuds. And then I did ask Advocate Ngutjana to try and get me the original or a full copy of all the things we submitted to the ombudsperson in order to refresh my mind. For what it's worth, I'll briefly reflect on the bit of information they were able to trace to get from that process. And the report of the evaluation compliance to the service standard and the financial analysis report of the 2014-15. I annexed here to the copies relating to the records of the deaths at the Life Esidimeni for the period immediately prior to the termination of the Esidimeni service level agreement.
Let me intervene. They've requested you to slow down. Yeah, the pace is too high.
So I should start afresh.
No, proceed, yeah. Proceed from 66.
I annexed here to the copies relating to the records of the deaths at the Life Esidimeni for a period immediately prior to the termination of the Life Esidimeni service level agreement, marked Annex D, Annex D1, D2, D3, D4, D5, D7, D8, and D9. And this is to the extent of my memory on what we had submitted and what was given to me, I think last week, Thursday or so. But the rest of the document in the greatest of details, I've not been able to have access to. But I know that we submitted huge volumes of documents.
Before you move away from that paragraph, let me understand, what is the purpose of the reference to this?
At the time when we submitted the report to the ombudsperson, we requested him to look at the causes of death for the number 36 that we are aware of at the time. But when we picked up that there was formal reports from Life which were sent to the department about death stats, and which I looked at those reports as we were preparing comprehensive submission to the ombuds. I was intrigued by the numbers that I saw in those statistics. Hence, I thought it's important that the Arbitration Commission should be aware of those and to look at them in the full context of what this arbitration process is doing, or in one way or the other.
So what does that mean? What does it explain in brief?
Do the statistics suggest to you that the death rate is the same as it occurred at NGOs? Or what significance do you draw therefrom? This is a suggestive question. It's a leading question I'm asking you. But you don't have to follow it. What did you see the statistics of life as Esidimeni to be telling you?
When we looked at the statistics, and I think it's the same information in a summarized version which was shared with the Premier when we met with him, I think it was on the 15th of September, if I'm not mistaken, where the officials were simply saying to us, indeed, there has been loss of life, which is regrettable because of once people have been moved from the NGO. And they also indicated that when at life, deaths were occurring, and these are quarterly reports, for instance, and to draw reference to this, to say between April 1st, which is a quarter, April 1st, 2013, and 30th of June, 2013, the numbers of people who would have died in just that quarter would have been 27. And if you look at July 1st to the September 30th in 2012, the number will suggest that there were 20 people who died in that one quarter. And again, if you look at April 1st, 2012 to 30th of June, 2012, the number suggests that there were 26 people who died during that quarter. And if you look at January 2012 to March 2012, 31st of March 2012, it suggests again that 27 of people died, but in the respective centers where life was accommodating the mental health users.
Yes, one has to say, contextualize it, of course, and say out of how many patients and at how many institutions, isn't it so?
Yeah, and then if you look at the 1st of October 2011 to 31st of December 2011, the numbers would about be 17.
But out of how large a cohort? How many people? It would be statistics of deaths in all centers of Life Esidimeni, or of a life group rather, or would it be? It's important for us just to find the proportion, isn't it?
Okay, I think, as I'm saying, I was looking for the files that we sent to the ombuds with all of these numbers, and as I said, I couldn't get that information. So I think through the advocate Ngujana and the team, they can help us probably to get that information.
You have attached, will it give us that proportionality?
I probably will give an indication. And as I said, Justice, in the files we gave, the details were very, if I remember, my memory serves me, were very, very detailed. To the extent possible, if we can have access to those files, I can refresh my memory for us to have that conversation about those numbers specifically. But as
what is your takeaway? From the numbers as you've seen them, what are you saying?
So the reason why we submitted this to the ombudsperson, and the reason why I'm referring them here, we asked the ombudsperson to say, please compare what would have happened in life over a period of 5 years with what was happening, what would have happened in the department during the process of the move. That was the purpose of sending this, so that we can look at what is the abnormal about these numbers, and then all of that, including looking at the causes of death and all of that. So that was the purpose, really, of submitting these numbers to the ombudsperson.
You know that the ombud has done that exercise in his report. Have you looked at it?
With the final report?
The death rate vis-a-vis cohorts of patients. And he writes about that in his report. Did you see that?
I can't remember the exact paragraph, or I can reflect. I can come back to that to you after lunch.
But to wrap it up, what more information do you need to complete your evidence?
I noted it down. I can indicate it later to the council.
That is fine.
Yeah, thank you.
Just proceed then.
I beg leave to take the arbitration through the statistics. That's what we've spoken about. And later I testified to the during the proceedings of the Professor Makhoba. To this extent, refer the arbitration to the findings on the ombudsperson. I think that's common sense. And finally, in conclusion, I want to submit that the Life Esidimeni project could have been handled better. and in a manner in which promotes human dignity, the right to healthcare, including not limited to the right to life. Once again, I want to apologize for the loss of life during the implementation of the project. I know that one life loss is too many, and I know that those lives, we cannot bring them together. But for what it's worth, I sincerely apologize to all the family members for the loss of your loved one. Thank you very much.
Thank you, Ms. Mahlangu. What's going to happen now is a process which lawyers call cross-examination. In other words, questions are going to be put to you on a variety of aspects arising from or connected to your evidence. There are at least four sets of lawyers, well, four sets of lawyers who represent different interest groups, as you know already. The one favor you could do us would be to listen quite carefully to the question, and if you could try and meet and answer the question, and if you're called upon to explain, of course, you can add an explanation. You're going to find that that makes even your own life easier. Some people try and anticipate what the lawyer is trying to get at, and it quite complicates their lives. So listen to the question each time and answer the question. Each of the counsel will introduce themselves as they always do. Advocate Hassan.
Justice Msaneke, I think we're not done yet with the witness. I just want to take her through one other
examination in chief.
Correct.
Oh, I see.
My apology for that.
Okay. The witness says she's done.
That's what is, according to her statement. Yes, the prepared statement.
You go ahead.
Thank you. Ms. Mahlangu, what I wanted to find out from you is, in March 2015, there was a letter that was written by the HOD, Dr. Silebano, and I'll share a copy with you. We'll read that into the record. And I want to compare, that is the contents of this letter, with what subsequently occurred. Let me beg leave to hand up a copy of the letter, dated 11 March 2015. Yeah. This one. No, one, just one. Give it to him. Yeah. I forgot the last element. Corrected.
Proceed, counsel. Has the witness been given a copy of the letter?
Yes, we'll mark that is letter as LR 126. Under discussions, there's a reference to a meeting chaired by the MEC of Health in February 2015. The MEC advised the LE senior management on the decision taken to reduce the LE beds and discussed the challenge of costs to continue funding the contracted care, and that the beds need to be reduced as soon as possible by a further 20% by April 2015. The department, together with LE, has to develop a plan to reduce these beds. Let's start at this meeting of February 2015. What was the resolution of this meeting, if you would still recall?
So this meeting would have been with Life. Is that what my understanding is?
Yes.
I think probably the discussion would have been around the costs in the department and no, I don't remember the exact thing, so I don't want to say things that I may not be accurate about. So, but I remember we had a meeting with Life. The exact specific of the discussion, I really don't recall.
So as I see the letter, that the main concern were costs, which you had identified as your challenge. And the solution to the challenge was that there has to be a reduction in the bed capacity by 20%.
I think the issue of the bed capacity reduction by 20%, when I was deployed in health in 2014, as far as my memory serves me well, so you meet with the respective departmental unit heads, and one of the things which was mentioned, and I can't exactly remember when was that mentioned, was that the 20% reduction which Life was supposed to have started implementing, they were not adhering to, and the department was raising concern each time. And on the basis of that, and I think that's what I think one of the things that was discussed in the meeting, now that I'm trying to remember, was discussed in that meeting. And it was also the issues about the tariffs that was discussed. So the 20% reduction was in line with the mental health strategy linked to the national policy and all of that. So when the meeting we had a meeting with Life was to discuss that issue and to say to Life, this is what legislatively we're supposed to do, and we're not complying to this. As to what we finally concluded in that meeting exactly, I wouldn't be able to remember. That is 2015.
Yeah, the last sentence says the department together with LE has to develop a plan to reduce this base. Was that plan developed?
I think so.
And what did it say about the reduction of bed capacity at LE?
You see, Council, so you have this letter that talks about the 20% and the reduction of bed by 200 per annum. So the same officials will go ahead and develop a plan to submit to Treasury based on the discussion that would have had in the budget committee to say, this is part of what we can do from a cost containment contribution. Clearly, there's something that just doesn't match in this process. So I'm not sure exactly why there seems to be a contradiction between this letter and what finally the very same official would have gone ahead and to prepare a submission which we send to Treasury officially for consider to indicate as part of our contribution. Life will be in that list of institutions that will review for the reasons that I've already stated in my former statement.
Yes, my focus that is on this is that we know that there is a policy, the national policy on mental health, yes, that deals with mental health, 2013-2020, and out of which you developed their own policy, yes, that is 2014-2020, and it sets out key strategies and priorities, and one of which is the reduction of beds by 200 annually. So my interest is, why was that policy not implemented to reduce annually? Instead, you ended up cancelling. And what I want to lead you to is, when was the decision to cancel or to terminate that is the agreement, against the background of these policies taken?
For instance, I'm seeing this letter for the first time. Remember, it's correspondence between the HOD and the CEO of Life. I'm not privy to this discussion and the correspondence between the CEO of Life and the HOD of Health at the time. So whilst he's corresponding with Life about this, on the other hand, he's working with the officials to say, let us ensure that what we committed in the budget process, we're able to adhere to that. As I said, I'm not sure why there would be such parallel processes that are happening and that they seem to be contradicting each other. So maybe it will be relevant to, just to look at the contents of the minutes, if there's any of this meeting referred to with the Life management, and probably can answer better if there's such record, which I don't remember seeing even when I was in the department.
Yeah, for now, we do know as a fact that on 29 September 2015, Dr. Silibano issued a notice, a 6-month notice to terminate the agreement. But in relation to when and who took the decision, he has been vague. So I want to find out from you, since he had indicated that they received instructions from you. All of them, Manamela and Mosenogo, were all consistent that instructions came from you. So what I want to find out is when was that decision taken, pursuant to which instructions were given to...
Well, there are many questions all wrapped up in one, Councillor.
Yeah,
let's go step by step. I mean, you want to ask the witness whether she gave the instructions or she made the decision to terminate.
Let's start with the decision. Did you take the decision to terminate? And if so, when was that decision taken? If you did not make the decision, who took the decision?
Council, the Qedani, government decision is never an individual decision.
Yes.
And I don't think it has been like that, and I don't think it's going to be anything like that in the future. The process I outlined in my statement gives the context under which, why and how the contract came under review, alongside many, many other things. So to say that the decision was Qedani Mahlangu, I think it would be misleading the public, because I outlined that we had a meeting with the Premier's Budget Committee. We presented, you'll see the original presentation that I made to the Budget Committee. There was no Life Esidimeni in that presentation. There was no Selby in that presentation. Of course, the operational issues were included in the presentation as cost-saving measures, because it is requirement, the format you are given by Treasury, that when you come and present your budget requests, you've got to demonstrate what you are going to do to save money from which programs, because the budget is under pressure, and you've got to look at where you're going to save. So let's start from there. Then subsequent to that, when you come from the budget committee process, then the HOD works with the team to develop a plan, and they look at what is it that we can do, and and remember, whilst we're doing all of that, there is a need and a pronouncement by all of us in government since 2005, if I remember, that all government departments must work towards receiving clean audit reports. So I bear that in mind, and in the background, at the back of our minds, that you need to achieve clean audit reports. In the same vein, you have the AG is raising concerns that you have perpetual contracts that are running without following supply chain procedures. So there's a contradiction already that you've got contracts that are running, and the more the AG raises the issues, at the later stage is going to be said, you spend money on contracts, and that is fruitless expenditure, irrespective of what we spend the money on.
Ms. Mahlangu, the question was who made the decision to terminate the Life Esidimeni contract. Can we deal with that?
Justice, I am explaining that the decision in government is never an individual decision. When the decision to terminate not only Life, the respective contract, it was our collective decision as a department,
okay,
after submitting to the
Let's start off
Treasury.
from the top. Was the Premier part of that decision?
Justice, I explained that there's a budget committee. The budget committee is chaired by the Premier. And when we present to the budget committee, then my presentation are here. You look at what the Department of Health said they're going to do from a cost saving. Life Esidimeni is not in our original presentation. From the budget committee, there's a requirement that says, go back and find things in the department where you can save money.
Did you terminate the agreement or give instructions that it be terminated?
I have no authority to write to anybody to terminate a contract.
Did the HOD terminate the agreement?
The HOD legally, formally wrote to Life and indicated the decision of the department to terminate the contract.
Was that his individual decision or was a decision from a collective?
It was a decision of the collective.
And who were in the collective?
It was myself, the HOD, and all of us in meeting. Remember, at Justice, can I please explain this?
Please.
And I'm going to repeat myself, but it's important to demonstrate to say this.
Please do. Mm-hmm.
Because I want to repeat that government decisions are not made by individual, and I don't think it's going to be tomorrow. The processes I'm outlining on how budget in government are conceived, and you go to Treasury, you seek approval on the basis of they say, no, we've got consent, this and that you're not covering. You go back, and then after you looking, okay, this is where we think we can find savings, because not only do you have a budgetary constraint, but you also have the AG raising issues on the same matters. So on the basis of that, then the department, we took a collective decision to say, these are the things we're sending to Treasury collectively. And we did not, there was nothing malice about all of those contracts that we implemented. And also, I think it's important, may I beg for your indulgence, Justice?
Oh, yes.
That Life was implemented after the team led by the HOD had completed the cancellation of Selby Park contract. And again, what is Selby Park? Selby Park was a hospital contracted, I think around 2003, 2002, 2003, if I'm not mistaken, as a step-down facility for people who were not too ill to stay in hospital, nor not too well to go home. They needed to stay somewhere. So Selby came into being on the basis of that. And while Selby was being used by government built 2 hospitals in the form of Begimlangeni District Hospital in Jabulani, and at the new Nataspreid, which is now a Telemukhran in Vosloorus. And one of the things that the AG was raising, and as one of the fruitless expenditure that the department was attributed to, based on what I'm going to say, that we had hospital beds, district hospital beds at Begimlangeni, as well as at Telemukhran, which were not being used, yet we were paying a private company the resources, and of course the issue that the contract was running year to year being renewed. So on the basis of all of that, as I'm saying, it's Life Esidimeni, the Alex Clinic, as well as Selby, all of these things taken together was really about dealing with our audit challenges, was dealing with the budgetary constraint that the department continuously faced. And I'm not in the system, but I want to believe that those challenges continue today.
And who were in the collective? It was yourself, the HOD?
The collective decided on all, once the team came up with all of this, the management of the department, all of us, we agreed, myself included, then the HOD, all of us agreed to say, well, this is what we're presenting to Treasury, and in the following year, Treasury will factor what we have said in our budget, and you'll see in the preceding presentation that those things have been factored in the Treasury presentation.
And who has to, once you've made the decision, let's assume for a moment you're entitled to make the decision, who was responsible for implementing it in a way that doesn't cause death to patients? Whose responsibility was that?
All the executing responsibilities relating to policy or to decisions of government reside with the head of department and the respective officials. In this instance, it will be the HOD, probably the DDG for clinical services, the Chief Director for Clinical Service, as well as the mental health unit and the respective officials that may be invited, where like the cross-cutting units in the department will be finance, led by the CFO, will be HR, it will be probably legal, because those, not all units have the same skills, but those, they serve the entire department.
And if the required steps for the transfer, steps, in other words, to safeguard the patient's life were not taken, who would you finger?
If
not the name, the capacity, the authority.
May you please repeat your question, Justice?
Let me try again. we've talked about the decision. We know it's a collective on your evidence. The next question I was asking was that who has to implement? You said it's a HOD. My third question is, if the implementation is reckless and negligent and unlawful, who would you, as a political principal, finger?
I think the respective unit dealing with the matter, in this instance, the Mental Health Directorate, which is responsible for the day-to-day running of the entire services relating to mental health, either be it life, as well as monitoring and working with the district there with the services that they are providing throughout in all the clinics in the province. And reporting, of course, to the relevant hierarchy in the department and finally to the HOD.
Do you have any
Yes.
further questions?
In relation to that, let me refer you to a section in the National Health Act 61 of 2003. I don't have a copy here, but I'll give you one later. It's section 25. It says provincial health services and general functions of provincial departments. It's subsection 1. The relevant member of the Executive Council, that refers to the MEC, must ensure the implementation of national health policy, norms and standards in his or her province. Will that be a reference to you?
Yes, absolutely.
Yeah. So, in relation to these policies you have referred to, I want to know from you, how did you ensure that those policies are implemented?
By work, first of all, having meetings with the HOD and the relevant teams, by also going on the ground and doing the work and looking at what I'm being told is actually factual, and also by listening to citizens to raise concerns where they have citizens, of course, members of the media. So those will be more or less the platform I traditionally use in whatever, particularly to a department like health and social development, where I had a privilege to serve. So that's how you monitor policy. But at no stage the expectation is the executing authority, in this instance will be the MEC, is expected to go on the ground and start doing the things themselves, because that will be in contravention with other pieces of legislation, particularly the Public Finance Management Act.
Yes. And just to move off from this point, you have referred to the national policy. Certain sections of the policy, I'll read them out for you. There's a document referred to as LR 124. I'm not sure whether it's in front of you.
Okay.
There are no page numbers, but when you count the pages, it must be 24 or 23. At the top, it says by 2020.
Is it after vision and mission?
There's a graph on the previous page. There's a paragraph 7.1, organization of services. Then there's a figure 1.1, low, high, low, high.
So what's the title? The heading?
It's a document, it looks like this.
Okay.
Then the following page.
I've gone through something like this. Yeah.
Are you on the page now?
Yeah.
At the top, it says by 2021, community mental health services will be scaled up to match recommended national norms and will include 3 core components. There's A, community residential care, including assisted living and group homes. B, daycare services. And C, outpatient services, including general health, outpatient services in PHC and specialist mental health support. Underneath that, these community mental health services will be developed before further downscaling of psychiatric hospital can proceed. In accordance with the Mental Health Care Act 2002, NGOs, voluntary and consumer organizations will be eligible to provide and be funded for community programs or facilities. This includes capacity development of users, for users, service users, their families to provide appropriate self-help and peer-led services, for example, as community health workers. So following upon this, you developed your own provincial policy, and which instructed you to downscale by, in line with this, to downscale by 200 annually. And we have had...
Well, at some point, you'll have to formulate the question.
Yes.
You put a lot of things to the witness.
Yeah. So, do you understand the passage I've read to you? Or do you want to comment on it?
You know, one of the things I was told, and I can't remember in which, whether it was through a media statement, and I think we did include it in the submission to the ombudsperson. It was indicated to me that since the legislation you referred to and that policy being approved, Gauteng has, at a time, had about 10,000 mental health care users in townships, in the community NGOs.
Yes.
And so with that in mind, when it is said we currently have 10,000 mental health care users in respective NGOs throughout the province, and when after the decision, we took the decision in line with all the things I've explained, when they move away from the hospitals that were initially identified to the NGO, I did not have any reason to disbelieve what I was being told, against the background that already it was indicated that there were 10,000 mental health care users within NGOs. So as to how long and what I was not informed, of course, about was how long it took to get those 10,000 mental health care users to NGO, over what period of time, that I was not aware of.
So you believe that the current NGOs that we had were better resourced to receive these patients? To
the best of my ability, that's what I knew. And also just to indicate that as far as I knew what I was told at the time, that out of the 25 NGOs where all the life healthcare users were taken from life to the NGOs, only 8 of those were new. That's what I was told. The rest of them were existing NGO. The only NGO I knew which has been existent for as long as I've been, as I had an association with social development on one kind or the other, was Takalani, which has been existing in Deep Blue for a long period of time. Other than Takalani, I did not know any other NGO that exists, but I was assured that there are NGOs that are credible, that are functioning, that have been doing this work. So expanding the work and them taking additional patients or the new NGOs, it is work that already the department has more or less got handle of the issues because of the experience of the 10,000 patients I'm referring to that were already with the NGOs.
So that will explain why you would not have reduced the capacity by 200 annually. Instead, you went for the termination.
It was on the basis of that information that, of course, there were questions and fights between Life and the department. Of course, the day-to-day engagement between Life and the officials I would not be aware in the greatest details, but I do know that there were issues relating to tariff increase year after year that was being requested, and the department says, but we do not have money, life says, but we need to increase the tariffs and all of that. So I'm aware that there was a back and forth arguments between life and the department about the issues relating to the budget and the affordability of the budgets and all of that. So on the basis of that, and with all the information available at my disposal, at no given point in time, did I have any kind of worries up until, as I said, the media started raising issues about food, about this and this and that. And I said, but what's going on here? And when these things persisted, the questions persisted, I thought, okay, there's something amiss.
That's a long answer.
Yeah.
That makes the point for short, pointed questions. We need to know what we want from the witness at that point, and the witness must give us what we need.
Yes.
Otherwise, we'll be here for a long time.
Correct, Justice Msanek.
Yes.
So already we have evidence from the head of NGOs in Gauteng, Ms. Hannah Jacobs, who had indicated that NGOs were not ready at the time. So will that too mean that you were lied to?
Advocate Ngujan, again, I'd like to repeat that if I am not given information, first of all, I'll never turn a blind eye in the position I held, not only in health, but in any other position. I'll never turn a blind eye on something that's going to put a patient or a person in danger. I was never going to do that. So I did not know that there were difficulties, as it is now known in public knowledge, about what has been said through this process.
Thank you, Justice Msanek.
Thank you.
I don't have anything further.
Advocate Hassan.
Thank you, Justice Masaneke. I see that it is close to the lunch adjournment. I have two requests. One is if we could adjourn a little earlier than 1:30, instead of beginning for a few minutes and then returning. And the second is that we have not been provided with the statement as yet, the final statement, or the annexures that were referred to during the course of Ms. Mahlangu's evidence in chief, and it makes cross-examination on that impossible. And I would like to stand down until we receive those documents.
That is fair. And your request is granted. So copies will be made available to all counsel. We don't need anything long. You must just assure me that it's going to happen. And they're entitled to it.
Justice, the copies would be made available to all counsel after lunch?
No, during lunch.
That's fine.
Okay.
I have an issue to raise with Justice. When the former MEC led her testimony in chief, she could not go through the annexures due to the unavailability. Now, as the way I understand the proceedings to be going, her evidence in chief has been finalized without her going through the annexures in her evidence in chief. That has an element of prejudice on her part. Of course, on my part, it would give us comfort if Justice was to say that at any opportune time, the former MEC would be afforded opportunity to go through those annexures, because when we started, the understanding was at the opportune time, the annexures would be made available. I was unaware that we would be required to go into cross-examination without her leading her testimony on the annexures. That has an element of prejudice.
I don't know what prejudice you're talking about, but I don't want to debate that now. Your role is very limited here. I'm sure you understand.
I understand that,
I think what you said and did this morning may have been just about all that you could be allowed to do. This is a witness and who must submit to questions and cross-examination. When the annexures come, as they come, the former MEC will have ample opportunity to refer to the annexures.
No, that gives me comfort.
Yes, indeed.
Yeah.
No, rest with the comfort. You will, once they're available, you find them, and the former MEC will go through them. Okay. Well, we have a request from Advocate Hasim. I didn't sense that any council thought otherwise. Well, as we adjourn, MEC, let me leave you with, you're still under your oath. Why did you resign? That is from your position as MEC.
I need to answer now. I thought you said I answer last time.
Please speak to the mic.
Okay. Should I answer now, Justice? Oh, I thought you were going to leave me with question to answer after line, so maybe I misunderstood you.
Fine. If your request is that you want to think about it, then you've got it. But if you're ready to answer it now, this whole exercise about accountability, so that is going to be quite, I'm sure you'll be asked about that by other advocates. But I'd like you to think about that during the lunch. And prepare an answer on why did you relinquish your political office. Okay. And we make sure that we get all the advocates together statements so they can prepare for cross-examination at 2:30 when we resume. Shall we then resume at 2:30? We are adjourned.
Good afternoon, everyone. At the back, at the parking lot, at the back, the white building there are bathrooms. So if you need bathrooms, you can go that side.